let's go have some fun. Let's talk about Elon Musk.
Yeah.
So
Um,
I apologize. This one is in Dutch. Apparently, it's also uh, you can find the international news. So Elon Musk, you guys may know, he bought Neuralink, and
yes.
news now came out actually a little while ago that he might be talking with the company called Synchron, um, which also makes implants, brain implants. One of the
Yeah.
advantages of this new Synchron device is that it's already been tested and I think approved for trials in the US and Australia. Um,
Ah.
yeah, so the article here writes it's ahead of Neuralink in the process to win regulatory clearance for its devices.
Ah,
And
okay.
one of the interesting things about the Synchron device is that it's implanted through the blood vessels. So you make an incision in your artery, and then you
Hmm.
shove the device up through your artery into the brain. And that means you don't have to do brain surgery to get it into the brain, which is,
Wait,
of
it's
course,
like do you use the artery in the neck?
yeah.
Like, oh, that
Mm-hmm.
makes sense. Okay.
So it's similar to like a stent, or like those
Yeah.
devices they use to open blocked arteries. If you have a cardiac infarct or something, and I don't know, I'm not a doctor. And it's relatively simple and straightforward to implant. The main downside to that, of course, is that you're kind of limited to where you can get it because you need a big blood vessel to get it to where you want to record. Um, so it's a downside and an upside.
Yeah.
But it's an interesting approach, I think, to intercranial human computer interfaces. Like if you
Yeah.
want to record from the brain without causing damage to it, then the device seems good. That's why it has been approved. Uh,
Yeah.
like we can see, oh yeah, I've here. I can um, link the webpage from Synchron. So they're saying accessing every corner of the brain. We have solved how to deliver electronics throughout the brain without open surgery. Um,
Wow.
I
In
mean, it's of
every
course.
corner. And
Mm-hmm.
then the brain turned out to be round. Sorry.
Yeah, so they call it the stentrode. It's an endovascular electrode array. So you can see it here
Ah,
on the right. It's basically just a bunch of recording sites. Um, and similar to a stent, it's designed not to cause long term inflammation or trauma to the brain. So,
yeah.
I mean, of course, it's designed not to do that. Whether it actually is, we'll have to see. But um, yeah, so they're trying both to restore, use neuroprosthetics. So basically, record from your motor areas in the brain and then control the limbs if you've lost a limb or lost control of your limbs, for example, through spinal cord
Mhm.
injury. Um, they want to treat conditions like epilepsy. If you can place this device in the center of, the locus of your epilepsy, like if you're usually epilepsy starts in a certain point in the brain, if you can pinpoint
Yeah.
that point and put a stent there and then give the right amount of current, you can stop that epileptic attack from spreading throughout the rest of your brain. So you can
Yeah.
stop epilepsy in its tracks.
That would be
And
pretty.
they can use it for neurodiagnostics, or they want to use it for neurodiagnostics.
Mm.
Basically, um, if somebody has a brain injury, they can try to record brain activity over a longer period and see what the cause might be. So,
I think it
uh,
has a lot of promise. Oh, maybe we have to tell everyone. It happens now in patients with severe epilepsy that like doctors are able to pinpoint the exact site of epilepsy, and then they do that's now a very invasive procedure where you also often implant actually electrodes, but then really into the brain, and then you confirm that this is the site where the epilepsy starts, and then you lesion that site, and this helps people who
mhm.
would otherwise be crippled by their epilepsy. That is only in really severe cases because that's very invasive to do. So if this could replace some of those surgeries, that would be very valuable too.
Mhm.
Mm.
It's a very different approach. So the Neuralink device is more, or at least in the current form, it's more, you open the skull, you take out the bit of skull, and you put the device on, and then they have like some micro threading needle thing to get the electrodes down into the brain. But you
Mm-hmm.
limit it to superficial areas because you can't go too far down because you have the
You
brain
would
to go
then,
through. You would damage
yeah,
the brain. Um, and another risk is if you have your electrodes right next to the neurons, very often you will see some inflammatory response and glia will start to cover your electrode, which has been a problem.
oh yeah,
Where these devices, these brain implants, become less and less effective.
yeah,
Um, but we do see deep brain stimulation devices like this are already being implanted in
yeah,
patients with Parkinson's disease, but also depression now, and I think
yeah,
also epilepsy. Um,
yeah, probably.
so
But
similar
it's all
devices do
very
exist. Yeah.
right. So this blood vessel solution is
Hmm.
interesting,
Yeah.
novel solution to this. Yeah.
Yeah. It's weird that Elon Musk would want to buy them though.
Why is that weird?
Well,
He
because
doesn't
he.
have he doesn't have any permission to do anything with humans. So he will speed up his
Oh,
human experiments. No.
well, I mean, theoretically, it's a different company with a different device. Just because if you own both companies, it doesn't mean that. Well, hey, my one company is allowed to do human trials. My other company should be allowed to do it too. Like it doesn't work like that. Um,
Oh no, of course not. No, but then
mhm.
I mean he needs to make money from humans, right? So if he can make money with any device because it's approved in humans, he will make money earlier. Isn't that the point?
I,
I
I,
thought
gen-
that was
I,
his point.
I genuinely don't know. Well, the thing, of course, with Musk is he makes some grandiose claims about, yes, we're
Yeah,
gonna cure, we're gonna upload the mind, we're gonna cure paralysis, and all of that. And we're a long way off from that. And I think
yeah,
even the Synchron is not doing anything that he,
like that. No.
wants to do. But then again, I don't know what he wants to do because he's a little bit vague on details. And yeah, I don't really. I suspect, his main driving goal, because it's the same with a lot of old rich people, is they want to do a brain upload. They realize at some point my brain's gonna die, but what if I just upload my brain into a computer? And he's alluded to that a few times. He's not gonna
Do you
get there
think
with
that
Neuralink, and I don't think he's gonna get there with Synchron. And the problem with things like Synchron and other similar devices is they're very expensive to develop. There's a very small group of people that it can help, and you don't
yes?
make that much money. Like
No, okay, yeah, that's true. No, I don't expect him to make a lot of money.
these are not companies like Tesla or SpaceX that will make billions or could
No, okay.
potentially make billions.
Well,
Uh,
SpaceX is a bit more tricky to make millions, but like cars, if you make cars, people will buy them.
yeah.
But like making money off sick people is a different business. It's
That's why, because he made, he had some comments about, maybe you want to control your car by just thinking about it. Sure, but I'm not going to get brain surgery just to replace a game
oh
controller.
my god!
You know,
No, no one's gonna do that.
no one's going to do that. Well, a few people
Like,
probably will,
well,
but
yeah, but then like they have to search for a doctor who wants to do it because like half of the doctors will say, "I'm not crazy. Why would you want that? You're not sick." So yeah,
um, of course, in that sense, though, I must say, the Synchron is way less invasive. I can see
yeah,
this being much more likely that people will
yeah.
use this device.
Yeah.
I still wouldn't because I already have two devices to control a car with. They're called my left and right arm, but some people will be crazy enough. I still don't think it's ever going to go mainstream, and I still don't think it's going to make a lot of money. But maybe, yeah.
No,
Um,
you still need surgery and antibiotics to like it's major to implant these things in dangerous.
yeah, well, the Synchron really is relatively risk free because I think I've read somewhere the operation only takes like half a day and you can go home the next day.
But with I think anything like any device you implant and leave in the body, even if you just put it in a blood vessel, I think you need quite some antibiotics, and antibiotics can be pretty nasty. And if you get an infection in the blood vessel in the brain, that can be a disaster, right? So the
Oh, sure.
risk,
Hmm.
like the recovery and the risk can be quite tough, and that's why you
Hmm.
wouldn't do it lightly. Like
Yeah,
even if
well,
the surgery is easy, there are so many things that can go wrong.
I mean, you or I wouldn't.
Yeah, but also many doctors would probably advise you to not do it,
Yeah, it
right?
only takes a few to do.
Oh yeah, that's true. Yeah, we also do a lot of plastic surgery, of course, which seems
Similar.
not necessary in each case, but people want it enough or think it's
Speak for
necessary enough to do
yourself.
it.
Some
So,
of us might want to improve.
yeah, that's what I'm saying. People will like in the people who do this in their eyes, of course, it's necessary. Otherwise, they wouldn't do a surgery and go through all the recovery and then do it again
Hmm.
just to change their appearance. So there must be a necessity.
I
Yeah.
honestly, if he can prove that there is some benefit, for example, for Alzheimer's.
Oh, yeah.
uh,
Yeah,
uh,
like, but then you would do it when you get Alzheimer's. But if I
I
would
mean,
get Alzheimer's, I
people
would,
that are in their 60s who just retired, they
yeah,
have a lot of money, no way to spend it.
I
Hey,
would,
here's a surgery that will help you be better for the next few decades.
yeah, yeah. Then you would, but you would have to see the first signs of Alzheimer's, I think. But you would
Well,
really do that.
you'll make some online webpage with the test you can do and test your cognitive fine. Oh no, your cognitive level is in the lower third percentile. You probably have
Yeah,
Alzheimer's.
yeah.
We
And
have
then
the
if you can do
solution.
it, yeah, and then you do it like the plastic surgery, like you just, yeah, no,
I
yeah,
may be
you can,
overly cynical, but yeah,
no, you can sell it.
you could
Of course,
theoretically create demand here.
yeah, but
Shall we move on?
yeah. Well, I wanted to say you can create demand for everything, right? Just you
Well,
need to make people realize that they need it. I have
you're currently in sales, Yoshi. So if anyone knows about that,
this is what I have learned. You just need to make people realize that they need your product,
you
and
really
then you.
need a patch microscope, don't you?
Sorry.
You really need a patch microscope.
Yeah. Well, no, you
Right.
don't tell people that they really need a pass. You make them realize themselves.
Of
This is the
course,
art
right. Like, oh,
to
but only
sell.
if you could do this type of experiment, wouldn't your
Yeah.
science be so much better?
Yeah, wouldn't you publish
Mm,
higher? Wouldn't
mm,
your results be like? Wouldn't the acquisition of results be more effective? This
who
is how you
knows?
sell things. So
Totally.
yes, you can definitely sell these kind of things to rich pensioners with Alzheimer's. Like the people just need to
A little bit
have the money.
cynical, but let's
No,
move on from this, please.
sorry. Okay, yeah, let's move on.